Hi, my name is Dawson. I run a dental marketing agency that helps dentists increase their implant and Invisalign production. If you're interested in getting some marketing from myself, feel free to book a call at the link below. Without further ado, let's jump right into the video. One of the top questions dentists are searching for right now on Google is how to sell Invisalign. Maybe you're new, maybe you haven't done your first Invisalign case yet. In fact, one of my clients in Louisiana is just getting their first case now. Or maybe you're like some of my other clients, like my one in Texas, that is a Diamond Invisalign provider. No matter where you're at in this process, I want to give you some valuable tips that are going to help you A, increase the amount of Invisalign patients you see, and B, increase the amount of Invisalign cases you close. The reason I'm making this video is some dentists that jump on our calls with me don't have any type of framework for selling Invisalign. Usually it's their first time. So just wanted to make this video as kind of a crash course into the different types of sales in the Invisalign process so you have a better idea and understanding of the game before we jump on that call. All right, let's get into the nitty gritty. So in the Invisalign selling process, there's really three types of sales. First is the lead, second is the actual consult, and then third is the Invisalign case. Now, depending on where you're getting your Invisalign patients from, maybe you're getting them from cold traffic from Google or Facebook or Instagram, or maybe you're pulling them directly from your existing patient base. This is going to determine how many sales you have to make. If you're pulling patients internally, the first sale and getting the lead is already taken care of. The patient already trusts you, and maybe you've done some routine cleanings on them. There's already a relationship established with them, making it a little easier to get them on the Invisalign case. What I recommend is focusing on which part of the process you're weakest at, or you feel least comfortable with, and really focus on mastering that part of the process. Maybe you're a dentist that can get all the leads in the world, but when the patient is actually in the chair, you feel kind of awkward bringing up getting them on Invisalign. You don't know how to phrase it or say it in a way that's going to be A, compelling, and B, something that's actually going to resonate with the patient. Or maybe you're on the opposite end. Maybe as long as they're in the chair, they're going to accept the case from you, but it's just a matter of finding enough patients to get in the chair for that process to happen. Like I said, focus on which part of the process you're weakest at and go from there. Let's look at the first sale and getting the lead. If you're marketing for the first time and you're really pulling patients from Google or Facebook or Instagram, you really have to build a lot of trust on the front end. One of the biggest headaches in this space is the lead quality is low. Usually that has to do with how you present yourself on the front end. Are you presenting yourself as a commodity, just another Invisalign provider, or are you positioning yourself as the go-to expert for Invisalign in your area? The best way to position yourself as an expert is to make educational content that's able to educate the patient on the Invisalign process, answering the top 5 questions they should be asking themselves before getting Invisalign, the difference between Smile Direct Club, Candid versus going into a dentist to get Invisalign. Answering these questions is A, going to build trust with the patient because you're giving them value, but it's also going to be beneficial and valuable for them because they're getting information from A, an expert, and B, from someone that actually knows, okay, they've gone through this process before. This isn't someone that has the head knowledge, they have actually done it. Look at this from the patient's perspective. Are they going to buy from someone that is just another Invisalign provider? Or do they want to buy from someone that they know is the expert in their area? If you're giving valuable content away in terms of the actual buying process and what they should look for in getting Invisalign, you're going to build that trust that will enable them to come in. The next sale in the Invisalign process is the actual consult. So now, whether it's from cold traffic, we actually have the lead, we have their information, or you're pulling internally, you have a patient that's in the chair for a routine cleaning. Now we have to get to convince them to come in for that actual initial consult to see if they're a good fit for Invisalign. Now let's start with the cold traffic first, and then we'll go over to patients that already know you. So when you bring this lead in, you really want to make sure you have a strong first impression. You want to contact them quickly, get them on the phone, start to build rapport, really find out the reason why they're getting Invisalign in the first place. Why do they call you, or why do they submit their info now as opposed to 6 months ago? Why are they doing this now as opposed to a year from now? You really want to find out what is that core reason and really be able to solidify that before they come in for the appointment. Now that we have them on the phone, we want to make sure we have the next available appointment slot in our mind so that we can quickly get them on the calendar, follow up with them once they've scheduled their appointment, call them a day before saying, hey, love to see you, ask for me, my name is Alex, or whoever is at the front desk. Would love to see you, want to see you at this appointment. That way, if they cancel, they're not canceling on the big bad dentist or the big bad orthodontist. They're canceling on Alex, the person that is actually establishing that connection with them. So it makes it a little, kind of changes a dynamic there. It's not, oh, I'm spacing out on a dentist that makes so much money and careless about me. It's, oh, it's actually Alex or Sandra, whoever is at the front desk. That's a little tip there. That's a little bonus tip for you guys. Now let's look at getting the consult from your existing patient base. The real key here is to get your hygiene department on board. Their whole goal is to plant seeds with your existing patients. Let's say they have a patient in the chair that could be a good fit for Invisalign. You want to give them empowering questions that are going to spark that conversation. For example, they could ask questions like, does having teeth that aren't straight concern you? And if it doesn't, that's totally fine. Kind of go about that appointment as you normally would. But if they say, yes, it does concern me, then that's when you can start to dive a little bit deeper and find out more on that. If it sounds like they're interested in getting Invisalign, then you can schedule that initial consult where they can really sit down and look at the numbers. Now, the final sale is getting them to accept the actual Invisalign case. The biggest thing here is you really want to find out why they want Invisalign in the first place. Is it for aesthetic? Is it for their long-term health? Really be able to identify that main reason why. Remember, you need to meet your patient's mind before you meet your patient's mouth. If they're getting Invisalign for strictly aesthetic, then you really want them to be able to visualize what their teeth are going to look like after the procedure. If they're getting Invisalign for the health benefits, you really want to emphasize that having a straighter smile can help with their breathing, can help clear their airway, as well as just helping maintain their teeth long-term. Having a straighter biter force is going to enable them to use their teeth longer. I hope you got something out of this video today. Again, there's really 3 types of sales when getting Invisalign. On the cold side, there's getting the lead, getting the actual appointment, and then closing the case. You're pulling patients eternally. It's really getting that consult and then closing that Invisalign case. So really be able to identify where that bottleneck is for you, where are you least comfortable in the process, triple down on that, master that, and ultimately you're going to see your case acceptance and your Invisalign production grow as a result. If you're interested in checking out our Invisalign marketing system, if you want to learn more about how we position our clients as the go-to Invisalign provider in the region, how we're able to get them high quality patients, not just leads, people that actually want to be in the chair and learn more about what they have instead of thinking about it or having to talk to their spouse. If you want to learn about our system that is able to bring people in without offering a discount, without you having to discount your service severely or even at all, feel free to schedule a call at the link below. If you enjoyed the video, feel free to give it a thumbs up as well as consider subscribing. Until next time, I will see you later.